Hi, this is Laurel Ruggles. I'm the VP of Marketing and Community Health Improvement here at Northeastern Vermont Regional Hospital in St. Johnsbury. And Dr. Michael Rousse, who's the Chief Medical Officer at NVRH, is here with me today. And Dr. Rousse, hi there, Dr. Rousse is going to do a presentation, tell you everything you ever wanted to know about the COVID vaccine. Are you ready for this, Mike?
And more, yes.
Okay, great. So whenever you're ready, you can start sharing your screen.
All right. Hi, welcome everybody. So yeah, Laurel and I have been, trying to get the word out about COVID vaccine and how important it is. And this is really going to be mostly about encouraging people to get their vaccine. So we're going to try to convince you here. So we'll see if we can do that. This is our presentation, and we're going to start from the beginning. A bit delayed. There we go. So I hope everybody can see that. This is really what we're going to be talking about. This is a pretty common photo now of photo reproduction of what we call the novel coronavirus or SARS-CoV-2 virus. It's called a coronavirus because of these things that stick off out of it like this, these spike proteins. And when we talk about vaccines, we're going to be talking about spike proteins quite a bit. And these spike proteins are the major target for these vaccines, because if you're immune to these spike proteins, then that virus, this whole thing, won't be able to get inside of your cells or do any damage. So, and think of these as three pieces of rope twisted together and stuck inside that globe there, and that's what we would call the spike protein. So we're going to talk about COVID-19 vaccine, and should I get vaccinated against COVID-19? The answer is yes. It will protect you from getting very sick, and it could save your life. It'll also protect your family and close contacts, and it'll protect your patients and their families if you're a healthcare worker or you do any other kind of work with other people. The big question on people's minds is it safe? And, as someone in the healthcare profession, and for years now, 30 plus years, I can tell you that as best we can tell, it is safe. These vaccines have gone through the same process that any other FDA product goes through, although quite a bit faster than normal. But these are not normal times. Normally vaccines take up to, they can take up to 10 years to get through the whole process. The fastest prior to the Pfizer vaccine was 4 years. Imagine that, and they did the Pfizer vaccine in 10 months. But there's a reason for that. The reason is, number one, the urgency of getting a vaccine out there, because this is a pandemic with 107 million people infected so far in the world, 27 million in the United States, and people were dying. 468,000 deaths as of today. So there was quite an urgency to all this. But the other thing is there was a lot of disease out there to be able to study the vaccine. There's been a number of times, like in the Ebola crisis or the MERS crisis, the Middle Eastern respiratory virus crisis, or even the earlier coronavirus infection that occurred a couple decades ago called SARS. And what happened in those cases is they tried to develop a vaccine for these terrible illnesses, but the disease went away before the vaccine could actually be put into broad use. In this case, the disease didn't go away. There was a lot of illness around, and so they were able to put the technology into this vaccine quickly, and they had plenty of people to study it on. So these are not normal circumstances. So far, the data shows that it's safe. Right now, 1 in 687 Americans have died from COVID. No one has died from the COVID vaccine, and there's been more than 31 million people have had at least one dose of the vaccine. So when we have pretty good experience with it. So if you're waiting to see if it's safe, we've got 31 million people who have can prove to you that it is safe. Right now, there are two. Yeah.
Yeah, I just wanted to say, Mike, so that is such good information because even though it seemed like it happened very quickly, it was built on, decades of science that got
Right.
to this point.
Yeah, and we'll talk a little bit because the mRNA vaccine, that is these two vaccines that are the major players right now, that technology was known about and had been put into place for some other vaccines, but never got commercially utilized. So right now, two vaccines are approved in the United States. The Pfizer vaccine I mentioned was approved on December 10th, 2020, and the Moderna vaccine got approved a week later, December 17th. These are both mRNA vaccines, or messenger ribonucleic acid vaccines. These are vaccines that take a small piece of messenger RNA and wrap it in a lipid nanoparticle. And there really aren't very many ingredients in this vaccine, but the technology and being able to formulate it into this very small nanopeptide that can goes in your arm, enters your bloodstream, gets into your cells, and then causes your cells to produce the spike protein, those little red tufts that were on the globe of the virus that you saw. And if you can get the body to produce just the spike protein, not the virus in its entirety, you can generate immunity against that spike protein, and that's how it works. So both of these vaccines completed their phase 3 trials. These were really good trials, randomized, double-blind, placebo-controlled trials. It means the researchers didn't know who was getting the placebo versus the actual vaccine. They were completely randomized. They didn't preferentially pick certain people. And they did them on over 30,000 patients each trial, so more than 60,000 patients. Actually, probably up around 70,000, but the numbers are not important. But about 15,000 actual vaccine recipients were in each trial. So 15,000 in the Pfizer trial, 15,000 in the Moderna trial. So how did it turn out? So the Pfizer, so you had 15,000 people actually got the vaccine, and of those 15,000 people, 8 cases of COVID occurred. And those 8 cases were mild. They didn't need to be in the hospital. They had very mild symptoms, and they recovered fully. Versus in the placebo group, the group that got nothing, they got just salt water, 162 cases of COVID occurred. And these were regular COVID illness where about a third of them had to go to the hospital and about 10% of them had to go to the intensive care unit, and a certain number of them had a very tough time with severe disease. So that translates into 95% efficacy. That's an incredibly effective vaccine. Similarly, the Moderna vaccine, again, over 15,000 people got the actual vaccine, and the end result was 11 cases of COVID. Again, all mild, none of them had to be hospitalized, versus 185 cases of real COVID illness in the placebo group. And same thing, some of those had to be hospitalized, and a certain number of them were in the intensive care unit. And that translates into 94.1% efficacy, which is hardly a difference. Very good numbers, so very effective vaccines.
Yeah, those are really remarkable results.
Yeah, when you compare, to some of the other vaccines that we give out routinely, like the shingles vaccine or the measles vaccine, measles, mumps, rubella vaccine, those have much lower numbers in the 70, 75% efficacy range. the flu vaccine that we take every year varies. Some years they hit it right, some years they don't hit it as well as far as if it's going to be effective against the flu that's around. It's been as low as 30%, 40% in some years. Some years, in a good year, it might be 70 or 75%. It's never 95% efficacious. This is really unheard of for vaccines. So these are really good numbers. They're different. They were both developed independently. They did their studies slightly differently, so they don't look the same when you compare them side by side like this. The Pfizer vaccine, they used a little younger cohort, a little younger group, 16-year-olds to the upper limit was however old the participants were in their 70s. The Moderna used 18-year-olds and older. So if you have someone in that younger age group, they need to get the Pfizer vaccine. Both are 2-dose vaccines. Pfizer is 21 days between doses. The Moderna is 28 days. There's a little leeway, about 3 or 4 days, plus or minus, is within the recommended interval. The Pfizer vaccine, not quite as stable as the Moderna. Therefore, it needs to be stored at what we call ultra cold storage. So minus 94 degrees C, that's incredibly cold. And that's because at any higher temperatures, it will break down and not be effective. So while you're transporting it around or storing it, it has to be ultra cold. Whereas Moderna, minus 25 to minus 15 degrees centigrade is roughly like a commercial freezer. So it's cold, but it's available in normal freezers. Once you take it out of the freezer, the Pfizer vaccine can hang out at 2 to 8 degrees C for 5 days, undiluted. And the Moderna, again, a little more stable for 30 days. So that's a lot better when you're trying to manage your inventory. And then when you get it to room temperature, 8 degrees to 25 degrees C is roughly room temperature. It's right around 40 to 75 degrees. You only have 2 hours undiluted. Interestingly, you have 6 hours once you put your saline solution in there and dilute it down. So 6 hours is enough to do a vaccine clinic. But you have to keep track of these times and keep everything logged in. Otherwise, your vaccine may not be effective. So we're getting pretty good at doing that, and we're very careful not to waste any vaccine. Moderna, similarly, you can only leave it at room temperature for about 6 hours. When we do a vaccine clinic, we keep them in sort of a cooler so that they actually have a longer period of time that they can be kept out. 5 doses in a vial of Pfizer and 10 in a vial of Moderna. These are not single-dose vials, unfortunately, so you have to really plan ahead when you do a vaccine clinic. And then Pfizer, you get mLs or 30 micrograms of the actual product. The Moderna vaccine, you get a little more, 0.5 mLs or 100 micrograms of the actual product. Now, these vaccines, they're quite reactogenic. They cause some side effects, and we're pretty upfront about it. We need to be honest about it here. You're going to get a sore arm from this vaccine, which isn't at all unusual from a vaccine. Shows that it's working. Your arm's going to be sore. Obviously, a number of people get fatigue the next day after the vaccine. About half get a headache, some muscle pain associated with it, chills, and joint pain can occur. Fever in about 14% of people. This is the Pfizer vaccine. And then similarly with Moderna, this is right off the package insert, pain at the injection site, 92%, so pretty much guaranteed. Fatigue the next day, 70%, headache. The myalgias are muscle pain, and arthralgias are joint pains. Chills, nausea, vomiting, swelling in the armpit of the arm that you got the vaccine, might be tender there. Some fever, again, 15%. Swelling where you got the shot, might even be a little red there in 10% of cases. So, quite a few side effects, but they all get better within 24 hours, and nothing is that severe, and the end result is that you're then immune to the coronavirus, which is the overall goal. Now, there is a third vaccine. Go ahead.
Oh, Dr. Rousse, can I just ask you, because we've done literally hundreds of healthcare workers here, hospital employees, and what are you hearing from them about the types of side effects that they're getting?
So, and believe me, we're right here. They're just getting vaccinated just down the hall, and they are telling us about what they're getting. I would say a number of people have had all of these things, pain in the arm to some degree, and then the fatigue, especially the day following the vaccine, has been pretty prevalent. Some people try to work through it. Some people go home. You go to bed early that night, and you'll sleep really well. You may sleep a little longer than normal, but it does help. I would recommend just trying, ideally, to have the next day not be something that you had to really perform at. That it might be a good idea to take a nap that day or go home early that day and go to bed early that day. But across the board, the following day, people say, it went away completely, I feel 100% better. I still can feel it in my arm just a little bit, and that goes away in another day or two. So that's about the course that we've seen. As far as severe reactions, we haven't seen anything really severe here. We had 2 people that got evaluated in the emergency room. They had a little bit of swelling and a very mild rash. We took it very seriously, but it did not pan out to be anything serious. They recovered completely. We did give them some medicine to help, like Benadryl and corticosteroid. They got 100% better. We have not had a true anaphylactic reaction or anybody collapse or pass out or have anything terrible. The rate of severe reactions is on the order of about 2 to 2.5 per million people. And so it's pretty low. Again, nobody has died from the vaccine at this point. I was talking about a third vaccine that's on the horizon, the Johnson & Johnson vaccine. This was put into the FDA for emergency use authorization on February 4th. And this is a little bit of a different vaccine. It's not an mRNA vaccine. It's a one-dose vaccine, one and done. It's a lot more stable, can be stored at refrigerated temperatures for 3 months, which is terrific if you're trying to run a vaccine clinic and having to carry this around, to rural places and things. The studies, now this is more realistic. It prevented COVID entirely in 72% of patients in the U.S. trial after 4 weeks, 57% in South Africa, and 66% in Latin America. And that had to do with variants that are present in those areas. The South African variant and the Brazil variant are having an effect on the efficacy there. But it's 85% effective in preventing severe or critical disease. So when you look at that efficacy number, it's still very effective. If you got COVID, you won't get that sick. You won't have to be in the hospital. You won't get intubated. You won't get this, and you won't die from COVID if you get the vaccine. Side effects are consistent with other COVID-19 vaccines. This is a whole different way of doing it. They use a plasmid with the DNA of the spike protein, the protein on the ropes that are sticking out of that globe, only it goes into the cell via an adenovirus, inactivated adenovirus, which is a common cold virus, and it makes you produce that spike protein and generates immunity that way. So just a different way of doing basically the same thing. But you can see the efficacy is dropping off just a little bit. But the convenience of one dose and the the stability of being able to keep it in a refrigerator for 3 months is pretty good. Go ahead.
So, Dr. Rousse, can you just talk a little bit more? So what happens when you get the vaccine and then you do happen to get exposed to COVID-19? What happens is your body kind of recognizes those spike proteins and then goes after it. Is that an accurate way of describing it?
Yeah, so think of it as priming your immune system so that when it sees something like a spike protein, it's ready. The first time you gave the vaccine, all you got was the spike protein. It wasn't attached to the rest of the virus. But the next time you see it would be because you got exposed to somebody that gave you the coronavirus, and your body will be ready. It sees it, and before the virus is able to take hold in your cells and get in your cells and start replicating, which is what the illness really is the virus goes in, takes over your cells, and makes millions and billions of copies of itself so that you're then infected and transmitting the virus. Before it has a chance to do that, your body goes in and starts to neutralize that virus before it even gets to take hold. And that's the whole idea. Prime the immune system and get it ready so that it knows what to do when it sees it the next time.
Great,
that's exactly right. So right now we're trying to get this vaccine out to everybody, and we're trying to do it in as organized a manner as possible. I mean, ideally, we would have just hundreds of millions of doses at the ready, and we could say, just come in and we'll give you a vaccine. But we can't do that because it would be pandemonium, and we already got a pandemic going, and we don't want to have pandemonium in a pandemic because that's a really bad combination. So we have an organized way of rolling it out. The idea was we need the healthcare workers in order to be able to take care of people who have the illness. So if we don't vaccinate the healthcare workers, then they're going to be sick and they're going to be vulnerable when they go to take care of people with the illness. So phase 1A was to get the healthcare workers vaccinated, and then the other really vulnerable population were the folks that are in long-term care situations. So nursing homes, frail elders that are in community care homes, and those are the people that were really suffering from this illness. And you probably heard about nursing homes with 50 patients infected, and a whole bunch of the staff were infected, and it was just devastating. So they were the first targets to get the vaccine. That started on December 16th. So we're here in Vermont, we are pretty well done with healthcare workers and long-term care homes getting vaccinated. Our long-term care facilities have vaccine rates in the 90+% rate, and healthcare workers, some of them are in the 90% rate of uptake of the vaccine. So beginning January 27th, we started doing what we call age bands. So everybody 75 years of age and older began getting the COVID vaccine. And we're trying to get through everybody who's 75 and older. That's about 49,000 Vermonters, as far through that group as we can before we go to the next group, which is planning to be the 70 and older group. Obviously not quite as big a group, and hope to get through that quicker. And then we go to 65 and older, and then phase 3 is going to be when we do basically everybody else, age 16 to 65, if you use the Pfizer vaccine, and all those with high-risk medical conditions. So we're trying to get, the goal is to get the people at highest risk of dying from COVID illness. And if you've heard Dr. Levine talk about it, most of the deaths, some 90% of the deaths in Vermont have been in people 65 and older. So we're really targeting that group because we're going to have a real impact on the death rate. The general population, everybody else, is phase 4, and we hope to get to that group by summer. And it really looks like we're going to get there. The way people are utilizing the vaccine clinics and pharmacies, and we have mobile clinics going out into some rural areas. It's very promising. The rollout, as much as people are concerned that it seems like a long time that they're waiting for it, we actually are getting a lot of people vaccinated fairly quickly. So I'm pretty pleased overall with the way it's going, and we just have to keep working at it. Now, high-risk medical conditions, I've listed them here. Anybody with current cancer, chronic kidney disease puts you at risk for not doing well with COVID illness. And obviously, COPD, chronic obstructive pulmonary disease, or emphysema can cause you to not do well with COVID at all. If you have underlying heart disease, including heart failure, it's worrisome. If you're immunocompromised, so you take medicines that try to blunt your immune response, like you have rheumatoid arthritis or Crohn's disease or ulcerative colitis, you tend to not do as well because we're trying to keep your immune system from overreacting, and you may not fight an infection off from this virus as well. Severe obesity in and of itself is a risk factor for COVID. Unfortunately, people with high body mass indexes don't do well when they get infected with COVID. Diabetes affects your immune system. High blood sugar is not good for fighting off infection. This is an upsetting one. Pregnancy in and of itself, pregnant women don't do well if they contract COVID during their pregnancy. And this has implications because the vaccine was not studied on pregnant women directly, but it still is recommended because of the risks of COVID that you get vaccinated. Down syndrome and sickle cell disease are also risk factors for not doing well with COVID. So any of these conditions are going to be put up higher in the priority list for getting vaccinated. So there are a number of questions that people have, and I was going to go through some of what we consider the frequently asked questions here. One of the things that comes up pretty commonly in these forums is, can the vaccine give me COVID? And it's a good question. We're giving you something that is meant to prevent COVID, but does it actually cause you to get COVID? And the answer is no, because if you remember, we said we're giving you something that makes you immune to the spike protein, but we're not giving you the entire virus. So you can't get COVID just from the spike protein, and so you can't get COVID from the vaccine. Now, there are, of course, hundreds of thousands of people that have gotten COVID over the last 12 months or so. And is it better to just get COVID illness than to get the vaccine? And the answer there is really, it is not better to catch COVID. There's a lot of risk to getting a COVID infection. We know that about 10% of people don't do well. They get very sick. They have to be in the ICU. Some of them have to be intubated, and some have multi-organ collapse when they get this COVID infection. So it's a risk you don't want to take. And the immunity that you get from a natural COVID-19 infection, we don't know how long it lasts. There's a recent study that said it could be as long as 180 days or 6 months, but we don't know how much it goes beyond that. So you wouldn't be immune for life. We would consider it much safer and better to get it through the vaccine rather than wait and catch it. This isn't like chickenpox, where you go to a chickenpox party and you try to catch chickenpox at a young age so that you don't catch it later in life. This is much more serious than that. If you get vaccinated, can you go back to normal life? Normal life being in quotes. Normal life being you don't have to wear a mask. You don't have to worry about being in crowds. You don't have to worry about catching COVID? And the answer is not yet. We don't have anything approaching herd immunity yet, so there still is a chance of catching COVID. Remember, even in the studies, 8 out of 15,000 got COVID. I mean, that's not 100%. So you can still, at a very low rate, possibly contract COVID. You probably won't be very sick. In fact, you may be asymptomatic, and you won't even know it, and you could transmit COVID to loved ones or other people. So for now, everybody still needs to wear a mask. You need to avoid large crowds and gatherings and still maintain social distancing, even if you get vaccinated. So if you've had COVID-19, should I even bother to get vaccinated? And the answer is yes. Because again, I mentioned, we don't know how long your immunity lasts. So if you have a COVID-19 infection and let's say 3 to 6 months pass, you probably aren't protected, or you're not adequately protected at that point. So we recommend 90 days after your infection that you do get vaccinated with both doses if you're getting the mRNA vaccine. So one question is, if you're injecting mRNA into my body, does it change my DNA or my genetics or anything? And the answer is no. mRNA, which is the active ingredient in the Pfizer and Moderna vaccines, is very short-lived. It's very unstable, actually, small piece of protein that is only there to tell your body to make that spike protein, and then it goes away. It probably only hangs around for a day or so, get your production mechanisms all revved up, and you make a bunch of the spike protein, but then within a few days, you couldn't find it. If you look for it, it's gone. It doesn't hang around, and it doesn't get into your DNA at all. Is it safe to get the vaccine if you have a weakened immune system? And this comes up frequently. People who are getting chemotherapy, or they're on immunosuppressive drugs because they have rheumatoid or some other connective tissue disease. Is it safe for them to get it? It's definitely safe to get it. We do worry a little bit that your immune response may not be as vigorous if you're on immunosuppressive drugs or, drugs that are trying to quiet your immune system down so that you're not overreacting against something else. You may not get as bold of an immune response, but you will get an immune response, and some is better than none. So it is better to get it if you have a weakened immune system than not getting it at all. So we're quite confident about that. More needs to be done to study how well your immune system does respond if you've got immunosuppressive drugs on board. Is it safe to take the COVID vaccine if you have a bleeding disorder or you're on a blood thinner? And the answer is yes. There's no contraindication or reason not to get the vaccine if you're on a blood thinner. We do ask that you let the nurse or whoever's giving you the vaccine know that you're on a blood thinner. There are times that we have a thinner needle and we hold a little more pressure over that spot so that there's no problem with bleeding. But it's not a contraindication. In fact, chances are if you're on a blood thinner, you have a condition that you'd do better if you were vaccinated. Is it safe if you have an underlying medical condition? And the answer there is yes, because, a lot of times underlying medical conditions like high blood pressure or kidney disease or liver disease are conditions that you're going to do better if you're vaccinated than if you're not vaccinated. So the answer is yes. If you have an underlying medical condition, there's a chance you might be in a high-risk group and would benefit greatly. We brought this up earlier. If you're pregnant, nursing, or planning to become pregnant, should you get vaccinated? This is a personal decision. It's not a contraindication. That doesn't mean you can't get the vaccine, but you need to make this decision informed perhaps with your provider about whether to shelter and try to avoid getting COVID while you're pregnant, or get the vaccine to prevent you from being able to get the COVID illness. But we do know if you're pregnant and you get COVID, you do get sicker and you have a higher risk of getting hospitalized and even dying. So that needs to go into your planning. If you're somebody that can maintain isolation and you can confidently say you're not going to catch it, then you could probably get away without it. But for most people, I would recommend it. Now, there are many types of vaccines being developed. And should I wait and see what comes later? Should I wait until the Johnson & Johnson vaccine is approved? There's an AstraZeneca vaccine that's in the wings that's going to be applying soon. There are going to be many different vaccines out there available, which is good because we need more vaccines in the pipeline to get everybody vaccinated. But I wouldn't recommend, if you have a chance to get the vaccine, as soon as your number comes up, you should get the vaccine. And that might be the Pfizer, the Moderna. In a few months, it might be the Johnson & Johnson, but I wouldn't wait. I think very few places are going to give you a menu and a choice of which vaccine you get. At this point, getting vaccinated is the key. So I wouldn't wait. I don't think what's coming down the road is going to be that much better than what we have right now. So I wouldn't wait. Any other questions you think would be helpful to get an answer to at this point?
You've answered all of my questions, Dr. Rousse. It's been very informative as usual. Thank you. So
I had just a couple slides. This just came out from the state yesterday, and it's a good summary of, where is all this vaccine going? So the state has done a good job in getting vaccine out to all the hospitals. The hospitals, the 14 community hospitals in the state, have been serving as kind of a hub because we're used to handling medicines. Our pharmacies and pharmacists are really good at maintaining inventory control and temperature control. So all the hospitals have had vaccines so they could vaccinate healthcare workers and get vaccine out to the nursing homes, and now are expanding to some of the clinics to do the 75-plus population. The health department has a district office in every county, and they've been putting up these point of distribution clinics or pods. And here in St. Johnsbury, we have a health department district office clinic at the Green Mountain Mall. They've been vaccinating people on Thursdays and Fridays there in the 75-plus population. And you can get on that list, get scheduled by going to the healthvermont.gov site and getting the information for scheduling. There's a phone number and a website to do that. 3 of the federally qualified health centers in Vermont, Northern Counties here in St. Johnsbury, Northern Tier Center for Health, and Little Rivers Healthcare down in Wells River have been getting supplies of vaccine and doing their population. And just yesterday they announced probably a more widespread distribution to these FQHCs around the country. Kinney's Drug Stores, 20 of them, have been giving out vaccines. That can be scheduled through their website. And home health agencies and hospice agencies have been vaccinating some of their clients. Emergency medical services like Calix have been going to some of the homebound population. Just heard today Michael Wright saying he put on 421 miles yesterday going out to various people's homes that are homebound, shut-ins, and getting their vaccine. He did 50 vaccines yesterday doing that.
Oh,
and then around the state. The long-term care partnership program is a program that has contracted with some of the pharmacies to go into the nursing homes and vaccinate the residents of the nursing homes. And that project is mostly done now. So there's been a great uptake of vaccine at the nursing homes. And then another recent program, this is another federal program, is the Federal Retail Pharmacy Partnership with Walgreens here in Vermont. Walgreens is going to be offering vaccines in 20 of its 31 locations. So again, you'd go to the Walgreens site and see if they have vaccine available. And then in the coming weeks, there's going to be other locations as allocation allows. It'll be a while before it shows up in primary care offices at this point. So going to your primary care office is not where you're going to get your vaccine just yet because of some of the logistics, the storage, and it also would, take them offline for being able to take care of other problems if they're suddenly tasked with doing a whole bunch of vaccination. The Homebound program, this was again a slide from the state, is a partnership between home health and EMS agencies. Right now they're doing people who are 75 years and older. The big thing here is if you are homebound and you're not part of a home health agency, it's recognized that there are some people that just don't have any connection there, and eventually they're going to need to be vaccinated. They're going to need to be identified and then expand this service by reaching out through other partnerships, including their primary care, agency on aging, municipalities, to identify the rest of the people who are homebound, can't go out to clinics to get their vaccine, and they'll get that vaccine delivered to them. So we really are trying very hard to get vaccine to everybody that needs it at this point. It's a all hands on deck effort to get this done.
Yeah, it's been incredible to watch. I just wanted to add a couple of things. Really the best way to get information about the vaccine is the Vermont Department of Health website. But if you want a quick and easy way to remember to go there, you can go to the NVRH website, nvrh.org. Right on our homepage, we have links to take you to our coronavirus page, which then takes you really quickly, just a couple of clicks to get to the Vermont Department of Health website, where they have the form where you can sign up to get a vaccine and also the phone number. We are also doing a lot of outreach in our area for people who maybe don't have access to the internet or don't have a computer or don't have a way to get online. So we've got people from our medical homes, our Community Connections program, that are trying to reach out to people to try to help them access the vaccine. Anybody out there who has a relative, family member, neighbor who you think might need help and you can offer to help them sign up for the vaccine, I really urge you to do that. And again, you can go to the hospital website to learn exactly how to do it, and then help anybody who might need some extra help.
Hang in there and get your vaccine. It's really important. And, we can see the light at the end of the tunnel. I think by summer, a lot of us will be vaccinated. You'll see some green zones opening up and people being able to travel, and some gatherings will be allowed. Just keep your ears tuned to Mark Levine, Dr. Levine, and the governor, and things are going to get better.
All right. Thank you so much, Dr. Rousse. Very informational. Really enjoyed it.
Thanks, Laurel.
Thank you.